Picture a quiet morning in Delhi. Mr. Rajesh, 68 years old, wakes up earlier than usual. Today, he has an appointment for a routine blood test. He showers, puts on his favorite kurta, and walks to the nearby clinic. An hour later, the doctor looks at his results and speaks in a serious tone. His blood sugar and triglycerides are high. The doctor suggests he might be in the pre-diabetic stage and may need medication. Mr. Rajesh is shocked. He has always eaten carefully, practiced yoga regularly, and never had a warning like this before. 2 weeks later, he goes to a different lab for another test. This time, the results are completely normal. So what happened? It turns out, on the morning of the first test, he had a cup of masala chai to have some energy for the trip without knowing that the test required fasting. Stories like Mr. Rajesh's are not rare in India. Many seniors make small, innocent mistakes before a blood test. But those mistakes can change the results, lead to a wrong diagnosis, unnecessary treatments, or cause anxiety for no reason. Blood tests are an important tool to detect conditions: early diabetes, heart disease, kidney and liver problems, thyroid disorders, and more. But if the preparation before the test is wrong, the results will not show your true health. In today's video, I will share 10 of the most common mistakes seniors in India make before a blood test. I will explain why each mistake can cause trouble, and more importantly, how to avoid them so your results are accurate and your doctor can give you the best advice. Stay with me until the end, because mistake number 9 is something even many nurses do not know. Let me start with a story I have seen many times. Mrs. Meena, 64 years old from Chennai, went for a blood test to check her blood sugar and cholesterol. That morning, she woke up at 5 a.m., made herself a small cup of coffee with milk, and had a piece of chapati to keep her stomach settled. She thought just a little, it won't matter. But her results showed higher blood sugar and triglycerides than normal. The doctor asked her to monitor closely and even suggested medication if it continued. She worried for an entire week. The next time she followed the fasting instructions exactly and her numbers were perfectly normal. Why can a sip of coffee with milk or a small piece of bread change results so much? It's because tests like blood sugar, triglycerides, and cholesterol react quickly to what you eat or drink. Even tea, coffee with milk, or a small snack starts digestion, raises sugar levels, and changes blood lipids. Once that happens, the test no longer reflects your real baseline health. But the problem is not only not fasting. I often see seniors fasting too long. They are so worried about affecting the test that they skip dinner early, then go for the blood draw late in the morning. This means they have fasted for 14 or even 16 hours. This does not make results better. In fact, it can harm accuracy. When you fast too long, your body increases cortisol to keep energy levels up. High cortisol can affect blood sugar and blood pressure. Mild dehydration from long fasting can make blood thicker, which changes creatinine and electrolyte readings. Some people even feel dizzy or faint during the test. So, what is the golden fasting window? For most fasting blood tests, the ideal time is 8 to 12 hours. That means if you have dinner at 8 p.m., you should aim for your blood draw between 8 and 10 a.m. During fasting, you can drink water, but only plain water. One more tip: in India, many people drink black tea or black coffee and believe it is fine. But even without sugar, these drinks can affect certain results, especially lipid and glucose tests. The safest choice is water only. Remember, getting this step right will help avoid wrong results, false alarms, and unnecessary stress. It gives your doctor the true picture of your health. This mistake is tricky, and honestly, it is not your fault. Many doctors forget to warn patients, and many patients do not think to ask. but some of the most common medicines and supplements can change your blood test results in ways you would never expect. Let me share an example. Mr. Sharma, 70 years old from Pune, had been taking a daily supplement for hair and nail health. It contained biotin. Harmless, right? At least that is what he thought. When he went for a routine thyroid check, his results showed abnormal hormone levels. The doctor suspected his thyroid medication was no longer working. But after a second test, this time without the biotin for 2 days, his thyroid results were completely normal. The supplement had interfered with the lab's measurement method. Biotin is just one example. It is found in many hair, skin, and nail capsules, and it can make certain thyroid tests look wrong. Sometimes it makes it seem like you have hypothyroidism. Sometimes it looks like your thyroid dose is too high or too low, even when it is fine. Now, let's talk about other medicines and supplements that can affect tests. Anti-inflammatory medicines like ibuprofen can change kidney function markers. They might make your creatinine level appear higher than it really is. Steroid medicines, whether tablets or injections, can raise blood sugar and white blood cell counts. If you are being tested for infection or diabetes, this can cause confusion. Water tablets, also called diuretics, are often used for blood pressure or swelling. But they can reduce sodium and potassium, giving abnormal electrolyte results. Vitamin D supplements, very common in India, can raise calcium levels if taken right before a test, making it seem like your parathyroid gland is overactive. Even herbal remedies like ashwagandha or tulsi extracts can affect thyroid and liver enzymes in some people. The problem is that most people do not think of vitamins, herbal powders, or even herbal teas as medications. But your body does not make that distinction. Whether it comes from a pharmacy, a supermarket shelf, or your kitchen, anything you swallow changes your internal chemistry, and your blood test can pick that up. So, what should you do? The safest approach is to tell your doctor and the lab technician everything you are taking. I mean everything, not just prescription drugs, but also over-the-counter medicines, herbal remedies and Ayurvedic treatments, vitamin capsules and mineral tablets, protein powders and nutritional shakes, special teas or oils that you consume for health benefits. When you list them, also mention when you last took each one. This helps the doctor decide if you should delay the test or avoid certain supplements before it. In some cases, you might need to pause certain supplements 24 to 72 hours before the test. For example, with biotin, most labs recommend avoiding it for at least 2 days. For iron supplements, it is often best to test iron levels in the morning before you take your daily dose. But, and this is important, never stop prescription medicines without asking your doctor first. For example, if you are on heart medication, it may be more important to keep taking it than to get the perfect lab number that week. Here is another real-life example. Mrs. Lata from Hyderabad had slightly high liver enzymes on her test. She did not drink alcohol, she ate healthy, and she was worried she might have a serious problem. But when we reviewed her history, she mentioned she had started an over-the-counter herbal tonic for digestion a week earlier. The tonic contains certain plant extracts that in sensitive people can irritate the liver. 2 weeks after she stopped it, her liver enzymes returned to normal. These examples are not meant to scare you away from supplements. Many are helpful when used correctly. But the key is transparency with your doctor, with your lab, and even with yourself. When you give a blood sample, remember, the lab is not just testing your health. It is also measuring the effect of everything you have put into your body in the last few hours or days. If you keep that in mind, you will help your doctor see the real picture, not a distorted one. So before your next blood test, take a few minutes to think, What have I taken in the last 48 hours? Write it down. Carry the list with you. Show it to the nurse or phlebotomist. You will be surprised how often this small step saves time, money, and worry. Let me paint a picture. It is a cool morning in Bengaluru. You arrive at the lab early, having skipped breakfast because your test requires fasting. You have not had a sip of water since last night. The nurse wraps a band around your arm, looks for a vein, and frowns. She tries the other arm. She taps the back of your hand. She warms your skin with a cloth. Still, the veins are hard to find. This is a scene I have witnessed countless times, and in most cases the cause is simple dehydration. Many seniors in India are mildly dehydrated without realizing it. As we age, our body's thirst signals become weaker. You may not feel thirsty even when your body needs water. On top of that, skin and veins lose elasticity, making it harder for a nurse to find a good vein. But dehydration is not just about the difficulty of drawing blood. It can also affect your test results. When you do not have enough fluid in your body, your blood becomes more concentrated. This means that certain numbers on your report can appear higher than they really are. For example, your hemoglobin and hematocrit may look high, suggesting a blood thickening condition when it is actually normal. Creatinine and bun blood urea nitrogen. Both kidney function markers can seem worse, making a healthy kidney look unhealthy. Electrolytes like sodium and potassium can appear out of range simply because there is less plasma volume in your blood. Now imagine the confusion. Your doctor sees these results and might think you are developing kidney problems or a blood disorder. You might be sent for extra tests, spend money and worry for days, all because you did not drink enough water. So how much should you drink before a blood test? Unless your doctor specifically says not to drink, which is very rare and usually only for special tests, you should drink 1 to 2 glasses of plain water about an hour before your appointment. That is around 200-400 milliliters. This is enough to rehydrate your body and plump up your veins, but not so much that you feel the urgent need to run to the bathroom in the middle of your test. A common question I hear is, can I drink juice or tea instead? The answer is no, not if you are fasting for tests like blood sugar or cholesterol. Even a small amount of sugar in juice or tea can affect those results. And coffee, even black, can mildly dehydrate you and influence certain readings. The safest choice is plain room temperature water. Here's a true example from my practice. Mr. Dinesh, 72, came in for his annual checkup. He had not had water since dinner the night before because he thought fasting meant nothing at all. His blood pressure was low and the nurse struggled for 10 minutes to find a vein. When we finally got the sample, his creatinine was slightly elevated and his potassium looked high. A week later, after drinking water normally before the test, both values were back to normal. That simple glass of water made all the difference. Some seniors worry that drinking water will dilute their blood and hide a problem. Let me be clear, normal hydration will not mask a real health issue. In fact, it gives the most accurate reading of your true baseline. Think of it like checking your weight. You would not want to weigh yourself wearing a heavy coat or holding grocery bags. In the same way, you want your blood to be in its natural balanced state, not thickened by dehydration. One more tip for those who take early morning walks before their blood test. Light walking is fine, but remember that sweating even a little without replacing fluids can also lead to mild dehydration. So if you walk, make sure you still drink your water before heading to the lab. In short, Proper hydration before your blood test is one of the simplest, cheapest, and most effective ways to help both you and your doctor. It makes the blood draw easier, faster, and more comfortable. It reduces the risk of false readings and unnecessary follow-up tests. And it keeps you feeling steady and alert during the process. Before your next test, remember your veins will thank you for that glass of water. Exercise is one of the best things you can do for your health. For many seniors in India, a morning walk, gentle yoga, or stretching is part of daily life. These habits keep the heart strong, the joints flexible, and the mind calm. But here is something you may not know. Exercising too hard the day before a blood test can change your results. Sometimes in ways that make them look worse than they really are. When you do strenuous exercise, heavy weightlifting, long-distance walking, or intense yoga flows, your muscles work harder than usual. This creates tiny tears in the muscle fibers. That is normal. It is part of how muscles grow stronger. But those micro tears release certain substances into your blood. For example, creatine kinase, CK levels rise after heavy exercise. High CK can also be a sign of muscle injury or heart problems. Without knowing you exercised, your doctor might think something is wrong. Liver enzymes like ALT and AST can temporarily increase, making it seem like your liver is under stress. Lactate dehydrogenase, LDH, another marker often checked in heart and muscle tests, can go up as your body repairs itself. I remember a patient, Mrs. Anita from Kolkata, who did an intense yoga workshop the day before her test. Her CK was 3 times higher than normal. She was sent for further tests to rule out heart issues, which caused her a lot of unnecessary anxiety. A repeat test after 2 days of rest came back completely normal. So what should you do? The simple rule is in the 24 to 48 hours before your blood test, stick to light activities. Gentle walking, slow yoga stretches, deep breathing exercises, or pranayama are fine. Avoid anything that leaves you sweating heavily, breathing fast, or feeling sore the next day. Think of your blood test as a photograph of your body's normal state. Heavy exercise the day before is like shaking the camera before the picture. The image is blurred and the details are not true to life. Give your body a calm, steady day before your test, and your results will show the real picture of your health. This is one mistake that almost no test instruction sheet mentions, but it can absolutely change your results. When you arrive at the clinic feeling rushed, stressed, or out of breath, your body is not in its natural resting state. Instead, it is in a mild fight or flight mode. Your adrenal glands release adrenaline and cortisol hormones that prepare your body for action. For a short time, these hormones can raise your blood sugar, increase your blood pressure, shift your white blood cell count, even influence your thyroid hormone levels. I once had a patient, Mr. Iqbal from Lucknow, who ran into the clinic because he was late and worried about missing his turn. He had been stuck in traffic, climbed the stairs quickly, and was nervous about the needle. His blood sugar came back high and his cortisol level was also elevated. A week later, in a calm setting, both results were perfectly normal. The solution is simple but important. Arrive at the lab a little early. Give yourself 10 to 15 minutes to sit quietly before the blood draw. Breathe slowly. Avoid reading stressful news on your phone or talking about worrying topics. Let your body settle into a calm, resting state. Think of it like weighing yourself. You want to do it when the scale is steady, not while it's shaking. A calm body gives the most accurate results. Many seniors assume that all blood tests are the same. You roll up your sleeve, the nurse takes a sample, and that is it. But the truth is, some blood tests need very specific preparation, and if you skip those steps, your results may be misleading. For example, fasting blood sugar or lipid profile, you must fast for 8 to 12 hours. Thyroid hormone tests. Fasting is not required, but the time of day matters. Early morning is best. Iron studies usually best done in the morning and not right after taking an iron supplement. Cortisol tests must be done at a set time, usually between 7 and 9 a.m., because levels change throughout the day. Parathyroid hormone and calcium should not be tested immediately after taking vitamin D or calcium tablets. I remember a patient, Mrs. Kamala from Jaipur, who came for iron studies after having her morning iron tablet. Her results showed very high iron levels. Her doctor almost stopped her supplements, thinking she was overloaded. The truth was, the tablet taken just an hour earlier had spiked the reading. The mistake here is assuming that the lab staff just knows what to do. While many labs follow good procedures, it is your responsibility to make sure you are prepared correctly. If your doctor's instructions are unclear, take a minute to call the clinic or the lab before your appointment. Ask directly, are there any special instructions for these tests? This simple step saves time, prevents false results, and avoids the stress of repeat visits. Your blood test is a snapshot of your health, but only if it is taken under the right conditions. When most people think about preparing for a blood test, they focus on fasting, avoiding certain foods, or remembering their medications. Very few think about what they are going to wear. But your clothing can make a surprising difference to how smooth or how stressful your blood draw will be. Let me explain. In most cases, the best vein for a blood test is in the inner elbow area called the antecubital fossa. To reach it easily, the nurse or phlebotomist needs quick access to your bare arm. If you are wearing a tight, long-sleeved shirt, a blouse with stiff cuffs, or several layers of clothing, it can be tricky to get to that spot. I have seen seniors arrive wearing a fitted kuota with narrow sleeves or layered sweaters during winter. Rolling up the sleeve can feel uncomfortable and may even cut off circulation. In some cases, people have had to completely remove an upper layer in the small, sometimes chilly, blood collection room. That adds to stress, takes time, and in some cases makes the patient feel awkward or exposed. Tight sleeves are not the only issue. Clothes with complicated buttons, hooks, or heavy embroidery can also slow things down. If you are already nervous about needles, the extra time it takes to arrange your clothing can make your anxiety worse. And for people with arthritis or shoulder pain, pulling tight sleeves up or down can be physically uncomfortable. Here is an example. Mrs. Shalini, 66, came for a test in December. She was wearing a heavy wool sweater over a long-sleeved blouse. The sleeves were snug, and she could not roll them up far enough. The nurse had to take blood from a smaller vein near her wrist, which was more painful and slower. The next time, Mrs. Shalini came in a loose short-sleeved top with a cardigan over it. The process took less than 2 minutes and was painless. So what should you wear for a blood test? Loose short-sleeved tops are ideal. If it is cold, wear a cardigan or shawl that can be easily removed or pushed aside. Avoid tight cuffs, stiff sleeves, or multiple layers that are hard to move. For women, a salwar kameez with a loose sleeve or a short-sleeved blouse works well. For men, a half-sleeve shirt or a loose kurta is best. Another small tip: make sure both arms are equally easy to access. Sometimes the nurse may choose the non-dominant arm, but if that arm has a weaker vein, they may need to switch to the other. If one sleeve is easy to roll up but the other is tight, it can cause delays. You might think clothing is a small detail. But small details add up, especially for seniors. A comfortable outfit can make the experience faster, smoother, and less stressful. It helps the medical staff do their job better, and it makes sure you can walk in and out with minimal fuss. Before your next blood test, take a moment to think about what you will wear. Just like you prepare your body for accurate results, prepare your clothing for an easy process. Your veins and your nerves will thank you. For many older women, menopause is a stage they have already passed. Some may also be on hormone replacement therapy, often called HRT, to manage symptoms or protect bone health. But what many do not realize is that their hormonal status and any hormone treatments they take can influence their blood test results in important ways. Estrogen, whether produced naturally or taken as medication, can affect cholesterol readings. Women on HRT often have higher good cholesterol HDL and lower bad cholesterol LDL. If the lab and your doctor do not know you are on HRT, they might think your heart health is better than it actually is, or they may misunderstand why your numbers are unusually good. Hormone therapy can also slightly influence thyroid test results, because estrogen changes how certain proteins carry thyroid hormones in the blood. And if you are having tests like FSH, follicle stimulating hormone, or LH, luteinizing hormone, to check menopause status, the results mean very different things depending on whether you are on HRT or not. I once saw a case where a woman's estrogen test came back unexpectedly high. She was referred to a specialist for possible hormonal imbalance. Only later did she mention she was using an estrogen patch prescribed months earlier. The result was correct, but without context, it looked alarming. The solution is simple. Always tell your doctor and the lab if you have gone through menopause, are currently on HRT, recently stopped HRT, use hormone creams, patches, or tablets. Even if you think it is not relevant, it is better to give the full picture. Your blood work does not exist in isolation. The meaning of each number depends on your body's background and current treatments. Being open about menopause and hormone use helps your doctor interpret your results accurately, avoids unnecessary worry, and ensures your care is based on the truth, not a misunderstanding. The test is over, the vials are filled, and you are ready to head home. But rushing out immediately can lead to problems. Sometimes the lab may accidentally miss a test or draw too little blood for a specific sample. If you leave before they notice, you might have to return for another draw. In rare cases, a label might be wrong, and without checking your results could get mixed up with someone else's. For seniors, there is another risk. Standing up too quickly on an empty stomach can cause dizziness or even fainting. I remember one elderly gentleman who walked straight out after his test, felt lightheaded in the parking lot, and had to be brought back inside. Before you leave, confirm with the staff that all tests ordered by your doctor have been completed. Ask when and how you will get the results. Will they call? Or should you check online? Sit for a few minutes, have a sip of water, and only go when you feel steady. A few extra minutes in the clinic can save you days of inconvenience and worry. We have gone through 10 of the most common mistakes seniors in India make before a blood test. Some of them, like not fasting properly or forgetting to drink water, are simple habits you can change today. Others, like informing your doctor about hormone therapy or supplements, are about sharing the right information. But all of them have one thing in common: they can be avoided with a little preparation and awareness. Remember, a blood test is like a photograph of your health at that moment. If the picture is blurry because of poor preparation, your doctor may misread it. That can lead to extra tests, unnecessary medicines, or worry that could have been avoided. So, before your next blood test, check if fasting is required and do it correctly. Stay hydrated. Avoid alcohol and heavy exercise the day before. Wear comfortable clothing. Inform your doctor and the lab about all medicine supplements and relevant health conditions. These small steps take only minutes, but they can save you time, money, and stress. Most importantly, they help your doctor see your true health picture so they can guide you in the right way. If you found this information helpful, share it with your friends, siblings, and neighbors. Many seniors face the same issues without realizing how easily they can be fixed. And if you have ever experienced a confusing test result that turned out to be a false alarm, tell your story in the comments. It might help someone else. Your health is your most valuable asset. Give it the respect it deserves by preparing for every test the right way. And remember, the more accurate the result, the better your doctor can care for you.